Hi everyone, good Wednesday afternoon and welcome to GoLocal Live and Smart Health, where we partner with the Warren Alpert Medical School at Brown University for the best and brightest minds. So I would like to welcome in Dr. Donnie Rice. Thank you for joining us today.
Thanks for having me here.
We're going to have a big discussion about Lyme disease and where things are at from a medical perspective. But first, I'm going to let the doctor introduce himself a little bit, his path to Brown, and what else he is focused on when it's not Lyme disease.
So my name's Don Rice, from Virginia originally, trained down there in medical school in Norfolk, Virginia, was in Pennsylvania at Philadelphia for residency, University of Connecticut for my infectious disease fellowship, and I've been at Brown here now for 2 years, where I'm a specialist in infectious diseases with particular interest in Lyme disease as well as HIV and Hep C care, and I also work at a health center in Fall River where I provide general primary care as well as infectious diseases care.
So let's focus on Lyme today. Now it is October, and you did mention there is a prime season for Lyme that has since passed. That's about 80%, but also can find cases 20% of the year. Let's break down Lyme, of course. You know, folks here in New England know about it, but let's talk a little bit about how it affects the body, and then we'll go into symptoms. So let's talk a little bit about what exactly Lyme does to a person.
So Lyme disease is a bacteria. It's in a species called Borrelia. It's distantly related to a whole bunch of other stuff that can infect us, but it's its own unique species of bacteria. Once a person's bit with a tick, usually in April, but sometime in the months before or after that, it infects us through our skin from that bite itself. It actually takes the whole feeding cycle for the tick to bite us, actually kind of puke in us a little bit and regurgitate, super gross. That's where the bacteria gets us.
Okay.
Starts to spread and our bodies react to that. That body's reaction is actually where you get most of your symptoms for Lyme disease, whether it's joint pains, fever, rashes, or headaches and things like that.
So let's talk a little bit about that rash. Everyone hears about, the bullet, if you will, the bullseye. Let's talk a little bit what is really physical that folks may or may not see.
A bullseye rash is great if you can find it because that's a guaranteed diagnosis and we know what we're doing and we can treat Lyme disease early and prevent pretty much all the complications. There can be confusing though because actually a tick bite itself can give you a bullseye rash, and the way that we tell the difference, if it looks yay big, the size of a quarter or smaller, that's just a reaction to the spit glands of the tick. But if that rash is larger, palm-sized or bigger, you know you have a Lyme rash, especially if it's kind of an oval, pink, nasty thing. From there, we can provide treatment easily. No need to wait for any sort of testing. All that can really do is mislead us. After that, you have issues where the reactions can become more what we call disseminated. Go from a localized reaction where the tick bit you to body reactions.
And what are some of those body reactions?
Really common stuff that can happen to folks is arthritis. Early in the course, you can get sort of just a nasty, fluey, ping-ponging arthritis in a variety of different joints. Later infections can cause it to settle in one joint, swell it up, and even damage the joint. Knees are the most common, but there's other ways that can happen. There's some really unusual cases, but we do see them where it affects the heart. People can have problems with their heart rhythms. Meningitis is a really common kind of infection where it actually inflames the lining of the brain and can cause things like nerve palsy. So if you see someone with a Bell's palsy, that's often from Lyme disease in this area.
And so if there are symptoms, again, from the bullseye to other symptoms as you expressed, when you go to see a health professional, as you said, treating it right away, what does that look like?
So the mainstay of treatment for Lyme disease is and has been for a while now doxycycline therapy. And there are alternatives for folks who either can't tolerate that for one reason or another. It can be irritating to the stomach, and it can cause a sun rash, such as amoxicillin.
Okay.
For folks that have that rash, 2 weeks is plenty. It averts all the later effects. Once it's become more disseminated or more established, longer therapy can be needed, up to a month.
And anything in addition to that is, again, doxycycline the gold standard at this point?
For classic Lyme disease, doxycycline is our workhorse. And there are other things that we'll use. For some cases where we think it's established an infection in the brain, we'll use IV therapy. For heart infections, we'll use IV therapy as well. And then there's folks that have later manifestations or post-treatment Lyme disease syndrome or post-infectious inflammatory disease syndrome where they have fatigue, brain fog, symptoms that are similar to depression, often with joint pains and malaise. Those folks, some of those folks will benefit from antibiotics and some may not. And for those other folks, we'll provide other holistic care approaches, such as breaking out and trying to make sure we address any depression that's associated from a chronic illness, anti-inflammatory diet, sleep management, and progressive physical activity to try and regain some of their function.
So you talk about the practice in Fall River. What are we looking at, doctor, in terms of numbers for Lyme? You've, as I said, been here just a couple of years now with Brown, but it has been a focus of your research. Where are we, especially regionally, since that's where we're at here on the show, is there going to be a time that we are able to get a handle on Lyme disease?
So Lyme disease is still fairly new. And if you put it in context, so it was first described in the 1970s, possibly re-emerging from a period of suppression due to the loss of the forests on the East Coast. As those have reforested, it's expanded its territory over the last 50 years. If you look back over the last 10 years, we probably have 200,000 to 300,000 cases in the United States.
Okay.
About 500 of those per year will be in Rhode Island. More if you look at the surrounding areas, but this is a particularly high prevalence area. Most of those, we said, are clustered in the springtime, but they can percolate in throughout the years, especially for the more chronic symptoms. Forgive me, can you remind me the last part of that question?
Again, what are we looking at? So with those numbers, have they, as you said, it's recently, as you said, emerged or re-emerged. Are we seeing increases in cases, or they tend to be the same year in, year out? What are we looking at in terms of numbers?
We've seen some variability. If you look at 2005, there were very few cases reported. You look at 2017, that was a record high year. Overall, we are seeing an increase in cases, probably from a few factors. One, as we reforest the East Coast back to its more natural state, we're seeing expansion of white-tailed deer and white-footed mouse populations, which are the natural cycle for the ticks that provide Lyme disease to us.
Okay.
So that's changing as we go through the years. Meanwhile, doctors are getting better at detecting Lyme disease. As we've got newer generation tests that have come online, people are trained better in how to find it and identify it. So we're seeing more case finding. Lots of efforts have been done to try and diminish the ways that we get infected. Some of those are going to be the Lyme vaccine from the 1990s,
Okay.
which is still available for pets. There's a new vaccine that's in development that we're hopeful will be valuable based on the OSP-A protein. There's all the personal efforts that we put in to try and minimize our tick exposure, especially in those high potential months of April, May, and June. And then environmental measures that you can do, like diminishing the amount of grass that you let grow close to your house and in high traffic areas so that you're not having high brush that you go through regularly, long pants, things of that nature to avoid exposures.
So you mentioned a 90s vaccine that you say is available to dogs. Was it not successful in humans?
It worked really well in humans, but there were some concerns about side effects. So that was still approved as a recommended vaccine for humans, but it's no longer in production.
And so with a new vaccine, is it in the trial phases right now?
Yes.
Here we are in New England. Is that something that you're going to take a child to if successful, could you foresee it being on that list of potential vaccines, or a vaccine schedule, if you will, or would it be more of an individual opt-in? I mean, how do you see it fitting in sort of like from a public health standpoint?
It's almost certainly going to be something that would be based on interest or risk exposure. I don't foresee it being part of the standard pediatric vaccine series, at least not in the foreseeable future.
So as you said, splitting time between Fall River and then, of course, here at the Warren Alpert Medical School with the students as well. From that academia standpoint, you talk about doctors, again, being able to recognize Lyme sooner, but again, addressing what can be a very debilitating disease for folks who have it. Where do you see science and academia in particular looking at and moving forward in the coming years?
So I think there's a huge role for obviously medical education, but also public health and outreach. If specialists are the only people that know what Lyme disease looks like, it's going to take ages for people to get diagnosed. So we did a large symposium last fall where we brought in local primary care doctors and helped them improve their education about Lyme disease.
Okay.
We're trying to reach out to folks to make sure that they know how to use the second generation testing. For example, the C6 peptide that's a little better at distinguishing active cases from prior cases.
Oh, interesting. Okay.
And there's just a lot of outreach to be done.
So, having been here for a couple of years, tell us, how have you found your time at the Warren Alpert School so far?
It's been a fantastic place to work. I spend my time in the inpatient floors of Rhode Island and the Miriam hospitals, helping folks with their antibiotics, helping folks get their diseases diagnosed when it has to do with a fever or an infection. And then the rest of my portion is my time is in Fall River, where I work at a health center and have a medical student from Brown over there as well that helps learn how to do family medicine.
Okay, well, as we like to do here on GoLocal Live and Smart Health, as I said, feature the best and the brightest from the Warren Alpert Medical School at Brown University, just a few blocks from here downtown. So, Dr. Donnie Rice, thank you for taking the time to come in today.
It's a pleasure.
Thank you for watching as we again bring you the best in medicine and academia from Brown here on GoLocal. That's it for now. We're going to be popping up in just a few with some politics inside the Beltway. So when you see us come back up, watch us here on GoLocal Live. I'm GoLocal News Editor Kate Nagel.
Wash your hands.